Hi, I'm Dr. Julie Steinauer, and today I want to talk to you about a success story of one of our patients who had a stroke and lost part of his visual field. So he has a homonymous hemianopsia, which means that part of his visual field was affected due to the stroke, which is either like the right or the left side. Now stay tuned because I'm going to go into more details about this, but first I want to tell you how to connect with me. If you are local, call our office at 618-288-1489. If you're not local, which would mean that you're in a different state or maybe you're in a completely different continent, then you can go to our website at visionforlifeworks.com and you have two options. You can either click on the questionnaire, which is going to kind of take you through a process to get to us, or you can schedule a consultation directly from that website. Okay, so let's talk about our success story. So I want to share with you, and I'm going to make sure that I block out this patient's name. But let me just share with you his right eye visual field test. So this is his right eye visual field test when he first started, before he started with us actually. This was from 2020. And then I want to show you the updated version, which was after he began working with us. And here is the change to that visual field. Let's see if you can see this. Okay, this is before, and then this is after he started working with us. So the more area that's open, white, or shaded gray means more vision is back in that area. Okay, that's the right eye. Now let's show you the left eye. So on the left eye, after he began working with us versus before, I'm folding these over so I can protect the identity of our patient with this. But this was his left eye's visual field, and this is his left eye's visual field after he's been working with us. So you can see on this side, there's a lot of visual field that's returning straight down below my finger here and all of that gray area. So what happens with a stroke in terms of causing something called a homonymous hemianopsia is that if a person has a stroke, depending on the area of their brain that it occurs in, it can affect the visual pathway. And what area of the brain is affected by the stroke will determine the visual pathway and kind of the amount of visual field defect that exists. But when we have someone who comes to us who wants to try to restore their vision, it doesn't matter if it's been a month or if it's been a year or if it's been 10 years. Although secretly, we obviously hope it's been only maybe a month since they've had the stroke. It's always easier to get the brain to kind of return visual field when it's not been a long time, but we do have success with patients even if it's been a couple of years post-stroke in helping them return some of their vision. Now what do? We actually use Syntonics, which we talk about a lot on here. In fact, probably about every video I talk to you about Syntonics. But Syntonics is a pair of glasses. Let's see if I have a pair. I have to dig. They're kind of back here. This is the first one I grabbed. This is a filter that we don't necessarily use for fixing and treating someone with a visual field defect like a homonymous hemianopsia. It just happens to be one I grabbed, and it just happens to be really, really easy to see. So let's just show you what this one looks like. Again, realize this is not necessarily a filter that we're going to utilize. Okay, for this particular patient case or similar cases, but it is one that you can see easily to see what it looks like to look through those goggles. So we use Syntonics. The patient puts the glasses on, they look at a light while they're doing it, and then they wear those anywhere from 7 to 14 minutes a day, depending upon what's going on with your particular case. And it electrically kind of reprograms the brain by sending not only electric or nerve type signals, but also blood supply back to the area where the stroke occurred. And this is really important because that's part of the key to restoration of the visual defect that exists post-stroke. There are other things that we do as well. It's not just about Syntonics. It is about like what we call massaging the area of visual field defect, not massaging like physical massage, but massaging as in working our way into that space so the brain gets kind of figuring out what it needs to do to return vision in those areas that are missing. So there's many things that we do. Our phase 1 program is Syntonics. Our phase 2 part is the more hands-on kind of approach to vision therapy. And both of them work together well to help our patients restore their visual field. So we can restore anywhere from about 20 to 80% of visual field, and this is highly dependent on quite a few factors, but one of which is where did the stroke occur in the brain? Another is there a good attitude about this? Is the person positive? Do they feel like they're going to have improvement? Another one is, are there other deficits? If there are severe deficits like motor delays, speech delays, and some other things, that can maybe introduce some difficulty. So there are quite a few things that we look at to tell whether a person is a good candidate for this type of program for restoring vision. Now, if you yourself, someone that you know or love, has had a stroke and has lost their visual field, contact us. If you're local, it's easy. Just call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can either fill out a questionnaire, and that's going to tell you a little bit about your vision, or what you can do is you can also just schedule a consultation direct with me. There's a little button, click it. It will walk you through the steps of setting up a time that we can mutually meet, and then we'll meet face-to-face in video about how we can help you. Now, if you like this video, hit the like button. We'd love it if you subscribe. You can watch us on YouTube. You can watch us on Rumble, and we would love it if you would pass this video along to someone who could benefit from it. Thank you.